When you think of the term hormones, what comes to mind? Probably the raging ones, right? The ones that make teenagers moody and pregnant women hungry and young men aggressive. Well, it's actually unfair to call those hormones raging because they're still pretty well controlled by the thyroid, a gland that sits in the center of the neck near the Adam's apple and which controls metabolism, growth and development, and body temperature. But that doesn't mean that hormones can't rage. They can, especially when the thyroid produces too much hormone. It's called hyperthyroidism, and it's a lot more noticeable than just a couple of mood swings.
So the general symptoms of an overactive thyroid, which again, just think of it as an increase in your metabolism, maybe it does tend to increase your heart rate. So a patient may experience this by noticing that they have palpitations, that they may get more easily short of breath, especially if they're doing even just the smallest amount of activity. Often they feel that they're much hotter than they used to be. So we call that heat intolerance. And they may notice that they have a tremor. They may notice that they have increased bowel movements, sometimes as much as 4 to 6 a day. They may notice as well, for unclear reasons, some people get a little bit itchy. It's called pruritus. Some may have that as well. They may lose weight, again, as they burn up calories more. And they have the combination of saying that they've noticed that they're eating more and yet they're losing weight. That kind of weight loss, although it sounds ideal, is actually an unhealthy weight loss because in general it's associated with a great deal of muscle weakness, which is one of the reasons that patients get so easily short of breath and find that their exercise tolerance may have gone down.
Oh man, I was all gearing up to catch me some hyperthyroidism, but not if I'm gonna lose muscle. I mean, it took a long time to build up these guns. Besides, that was a pretty weak plan to begin with, since you can't catch hyperthyroidism. It's often the result of another disease, like Graves' disease, or from having a nodule or a lump on the thyroid, which is secreting excess hormone. Now, while that excess hormone is the crux of the problem, the upside is that it makes diagnosing the disease very easy.
So we will analyze the thyroid levels that are both circulating in the blood and the pituitary TSH, which generally is totally shut off because this thermostat now is not needed since the thyroid is making too much thyroid hormone on its own. We will often measure what's called thyroid antibodies in order to determine if it's on an autoimmune cause. And we will, in terms of determining treatment, send the patient for a study that's called a nuclear scan of the thyroid, which gives the patient a tracer dose of radioactive iodine and sees how the body takes up that iodine. In hyperthyroidism, there's an increased uptake of the iodine. Iodine is a very important ingredient of thyroid hormone. So in an overactive thyroid, that uptake goes up, and usually we can then see the pattern by which this big gland is taking up the thyroid.
There are different ways of treating an overactive thyroid. Rarely it's treated with surgery. The most common treatment is radioactive iodine, which destroys part of the thyroid, and people with mild symptoms can take antithyroid medications.
If they are treated medically, meaning they don't get radioactive iodine, or they don't go to surgery, or which is very rarely done, but instead stay on medicine, may find that their dose is able to be tapered, stopped, and then they stay disease-free. Of the people that go on medication and are able to have their medication stopped, a percentage of those will flare again as their antibodies come back. We don't really know how to predict who is the person that will go into what we call permanent remission versus those that can simply be tapered off of medication for a while. But we always give patients the option. If they prefer a trial of medical therapy in order to see whether they could be one of that 10%, we allow it as long as they understand the side effects. The patients who have the biggest likelihood of responding to medical therapy are the ones who have the mildest form of an overactive thyroid and the smallest enlargement of their thyroid.
After you receive treatment, you'll need regular blood tests. These tests will alert your doctor if the hyperthyroidism is returning or if the treatments have triggered its doppelganger, hypothyroidism, which is when the thyroid produces too little hormone. But that's a topic for another segment. I'm Dr. Keller Wortham, and you're watching the eHealth Network. We'll see you next time.